Thanks, Dr. Tejal, for that. So, as endocrinologists and diabetologists, we are all very, very focused on handling obesity in the management of type 2 diabetes. We understand that bringing down weight can bring down even remission of diabetes. That is something that we're talking about now. We also know that it can bring down the dose of medications that your patient is on. It can also bring down the requirement of insulin dose, also maybe cardiovascular mortality in the long run. So there's a huge emphasis, and we know that you're coming from a good place when we want to talk about obesity. But for a person who's obese or overweight, trying to lead a normal life in the world, their perspective might be completely different. And these are screenshots of the character named Kate Pearson from the series This Is Us, which is on Disney Hotstar, I think. And this is probably one of the rare realistic depictions of what the life of a obese person is like. So notice here that she's taking her earrings off and she's bare naked before stepping on to her bathroom skills to check her weight early in the morning after she's voided her bladder and not even had a sip of water, because what that scale shows is equivalent to how she sees her own self-worth, right? That's the amount of baggage that goes into getting on a scale for a person who's battled obesity all or most of their life. Cut straight to what happens in your clinic when a person comes in with obesity and type 2 diabetes, right? So my waiting room is full most times, at least pre-COVID times. The weighing scale is a digital weighing scale, so the only place where I can fit it is in the waiting room. The room is full, and as soon as your patient walks in, my nurse or sister asks her to get on the scale. There is no guard to protect the number from being flashed to everybody in the waiting room to be seen. And right as she walks in, maybe my resident or somebody else sees her, and the first question they ask is, what was the weight that was measured outside, right? So for most people who are coming in to even seek help for weight, to begin the conversation with weight itself seems to take away everything else about them and just seems to push towards focusing on numbers. So people with obesity do have a whole lot of stigmatized behavior that they have been subjected to. Overall, numerous research has revealed that people do tend to think that people who are obese are lazy, they make bad food choices, they did it to themselves, and make it look like it is something about willpower or irresponsibility on that individual per se, and that obesity is not a disease at all. So there's already a whole lot of baggage that they come in with. So it takes very little, very, very little to tick them off. So this is what is referred to as weight stigma. It refers to negative behaviors and attitudes that are directed towards individuals solely based on their weight. Now, of course, we might all be making it all the efforts to make sure that we're not consciously being biased towards obese individuals, but some of it can be so ingrained and so implicit that we might be doing it completely unconsciously or involuntarily, which could be very subtle, which you and I might not pick up at all, but a person who is very, very sensitive to it will pick it up right away. It could just be the subtle that smirk in your face when she tells you her weight, or a subtle when you notice that the weight has gone up between last visit to this visit. And if you're thinking that this is just a first world problem, my patients who visit me in India definitely are not worried about weight stigma. This is a survey which was done across the globe, which looked at both explicit weight stigma and implicit weight stigma. And please understand that the prevalence of weight stigma is very, very high, even in a country like India, where we all tend to believe that our patients are not so sensitive. So let me just highlight one of the words which we very commonly use as a scientific adjective for obesity, right? We even grade obesity as morbid obesity. And this is how the Webster's Dictionary defines morbid as: characterized by an abnormal and unhealthy interest in disturbing and unpleasant subjects, especially death and disease. The second definition is abnormally susceptible to or characterized by gloomy and unwholesome feelings. An English lecturer looked at me when I wrote her prescription down as morbidly obese, and she said, "How could you ever think that you can write the word morbid against me in my prescription and hope that you're wishing well for me?" And I was stumped by how we are using some words which could mean something else in normal literature as scientific literature. And for you and me, morbid is a very common word. That's what everybody else is telling us to grade obesity as, but it comes with so much of stigma attached to this. So this was something which was implicit to maybe all doctors. We are not aware of it, but it was not deliberate. I was not hoping to send out signals of disease and death to her at all, but it took an English professor to point that out to me. So how do we move forward? What are some of the things that we can change? So one patient who's been seeing me regularly did say that, see, every single time, every doctor tells me is to lose weight, right? Now, it does not matter if in the last 2 months or 3 months, I've really worked out, I've really focused on eating healthy and I've lost weight. But if my weight is 98 or 100, whatever it is, at that visit, I'm always told to lose weight, right? So that is an approach where we are focusing on numbers, but probably a better approach is to focus on individual specific habits related to habit building towards healthier choices, right? So it could be increasing the number of days you exercise, or maybe reducing the number of binge eating episodes you've had this month, right? And what efforts your patient has put in towards building better habits and processes rather than focusing just on weight. So I might have gained 1 kg between last visit to this visit, but I might have exercised all days and I might not have had any binges at all in the last 3 months. So that is a visit where the patient must be congratulated than be admonished. So all of this put together, we have come up with this document called as Language Matters. Language Matters is a patient-led movement where patients came up and said, there are some of these words that you use which are harmful to us. So try and come and change. And Dr. Tejal, do you want to tell us how it's relevant to the Indian context?
Yeah, so much of what we discussed, you may think that, my patients don't experience this. I remember one person I spoke to, and they told me, मेरे patient मेरी डांट खाने सुनने के लिए आते हैं. They take my appointment so that I can scold them. So this is what most of us believe, that our intentions are good and our patients understand our intentions and they know that we mean the best for them. But we were shocked, and till today, sometimes the voices of these patients ring in my head because we'd recorded all of our research work, and I remember transcribing that entire 1 hour conversation, and those words still ring in my head. So what we did is that we did a series of focus group discussions across 5 states of India. We invited people living with type 2 diabetes, and we asked them to speak about their experiences with doctors, especially in the context of language, what words or phrases impacted them and did not impact them. And what we've talked about, the previous 2, one about elevated blood glucose and complications of diabetes or consequences of diabetes, and about obesity and diabetes, is just a snapshot of a lot of other things that we can change in the way we communicate with our patients. It's all put together in this document, which is called as Language Matters India. And this underlines the importance of language while communicating with people living with type 2 diabetes in India. I urge you, request you, that you must read this document, because when you hear what patients themselves say in their own language, you will understand what is it that we are trying to do here. And I think maybe also put aside being a doctor for a short period of time, and just as a human being, if you listen to this and you understand that we really need to speak with a lot more empathy and compassion than we are doing right now. Just one last thing I want to say, that this entire, document, this is in no way to say that doctors are not doing their best. But unfortunately, our medical training is not complete. We do not get any training in how to communicate a diagnosis, how to explain a prognosis. And because of this, we basically end up doing what we've seen our seniors or betters do. So I think it's time to kind of change the way we view, the way we speak to our patients. And small changes, I think, can make a huge difference in the lives of people living with type 2 diabetes.
And to say that most of the research was conducted or done with individuals from our clinics who were our regular follow-ups and whom we thought were actually happy with us. So that was one of the blows. So we were like, I thought you were one of the patients who was happy with me, but yet you were experiencing so much of hurt at our experience, at our encounters. So this was a very eye-opening experience for all of us. It's completely changed the way Tejal and I look at communication. We now introspect more. We now take a look at ourselves more and check in with patient responses, with their expressions, and how they're feeling. Most times, I strongly urge you to note the link below and get the document, because at the end of the day, we're all human beings and they come to us, they come to feel better, get better. And there's nothing else in life which is more powerful and not costly and the most underrated agent for human change as kindness is. With that, I'd like to have a special note of thanks to Dr. Mayur Patel and Dr. Mona Shah for giving us this opportunity to highlight some of the work that we've done and speak about a topic which is so close to our hearts. Thank you so much.